Hello, this is Dr. Mercola, and you may not be aware of this, but many of the top-selling baby products have some of the same toxins that the adult ones do. I guess maybe that's not too surprising, but it's concerning because infants and babies are so much more susceptible to these damage. I mean, you know that some of the softest skin you can get is on a baby, but it's interesting that many of the products you put on a baby's skin can lead to really significant problems. They have loads of problems like fragrances, parabens, BHT, toluene, and these are rapidly absorbed into their bloodstream because you probably are aware of this. You really don't want to put anything on your skin that you really wouldn't consider eating because in many cases, if not most cases, whatever you're putting on your skin is going to transfer right through your skin into your bloodstream. So it's just like eating it. Now it may be different taste-wise, but the end result is going to be the same. It's going to wind up in your bloodstream. So you have to be very cautious of what you're putting on your baby. And the baby, of course, is immature in many ways in the development of their nervous system, their immune system, so they're more particularly predisposed to toxic influence. And you have to be extra careful, extra especially careful. So one of the most common products that are used for babies are baby lotion, and it's typically used for diaper rashes or eczema. Now, eczema is an interesting condition that affects about 10 to 20% of babies, and it results in these patches, these red itchy patches that the infant and child typically scratches excessively. And there are some simple strategies that you can use because if a child has eczema, it's going to make the diaper rash much worse, and sometimes it could be really severe to the point where it can cause some pretty nasty complications. And you definitely want to catch this early and implement these strategies. Now, these are strategies I'm going to recommend not only help the eczema, but they also help the baby's overall health. And the primary one, the most important thing that you can do for your child is to make sure your child is breastfeeding. That really is one of the highest priorities possible that you can do. There's just no question about it because it's the perfect food for your baby. And really, I know there's many economic challenges for moms to not do that and to get back into the workforce and stuff, but if you really want to do the best you can for your baby, you should make every effort possible to make sure your child is breastfeeding. It's going to really be crucial. The other component, and this is also not possible for many who live in the United States in northern environments in the winter, is to give your baby regular sun exposure. And this ideally should be without any clothes and expose all surfaces of their skin to the sun. And of course, you want to be really cautious and careful. They never should be sunburned. So if your baby is very fair complexion, you may only want to do it for a few minutes to make sure they get some sun. But that's going to be very healing, very nutritious. It's going to improve their vitamin D levels, of course, which is radically important. But it'll also prevent many other conditions. In fact, you may not realize this, but there's a condition that babies have where they become jaundiced at birth, and that's usually due to elevated bilirubin levels. And the treatment for that is to put them under the lights, which really replicate the same conditions that they would get in sunlight. So it's very normalized and very healing, very healthy, and it will actually help improve your baby's skin. So they should have a nice little tan, if at all possible. Now, ideally, you want to avoid gluten and dairy. Yes, gluten and dairy. Not dairy from the mother. The mother's milk is totally different than cow's milk, of course. But you really want to avoid those because those are known predisposition factors for worsening eczema. Now, you may, an infant who's breastfeeding may not obviously be taking dairy or gluten, but the mother may. So if the mother is drinking cow's milk or is consuming wheat on a regular basis, then there's a likelihood that those antigens could be transferred through the breast milk into the baby and then cause this type of rash. The other component is you want to make sure that they're getting a high quality source of animal-based omega-3 fats, that one that has DHA and EPA, because the brain is forming, it's just rapidly developing at this stage, and the brain is 60% fat, specifically DHA. So that's going to be really an important nutrient for the future growth of the baby and make sure that it has the highest quality possible. It also improves the skin, along with another fatty acid called GLA or gamma-linolenic acid, which is typically in supplements like evening primrose oil or borage oil, that can, in combination with the animal-based omega-3 fat, form a very potent anti-inflammatory to help squelch any inflammation that's going on in the skin. So those are some of the key components. If you're doing those processes, then the need for lotions was going to be diminished. But if you're using a lotion for any reason, you're certainly going to want to use a healthy one. And that's one that we came up with. And one of the basic principles is to make sure that it's USDA certified organic, because these personal care products are under different regulations from the certifying agencies, and they're not the same as food. So really the only one that makes any sense is the USDA organic label, and that's the one you want to look for. And we've put some really healthy ingredients in this baby lotion, this natural ingredients that you could potentially eat. Remember, anything you put on the skin is going to potentially go in your bloodstream, so you want to make sure it's food grade and something you would eat. So what's in this baby oil? Coconut oil, safflower oil, shea butter, aloe vera, jojoba butter, and many other immune support building herbs that really have been shown to be useful in improving the skin. Now, some other helpful hints for taking care of diaper rash are really some common sense things I just want to emphasize, is that you really want to avoid using baby wipes. I mean, they're convenient and they're easy. They look like they're the right thing to do. Certainly many other people are using them, but they're loaded with chemicals. The last thing you want to do is use those baby wipes. Instead, get yourself a cotton base, or preferably organic cotton, lukewarm water, washcloth, and wipe your baby's butt with that. That's going to be a lot easier. And also stay away from talcum powder, because that dust that can form and get into your baby's lungs, and that can cause loads of problems. So stay away from talcum powder or cornstarch, the same type of things. It can damage your baby's lungs. And then you clearly want to change your baby often. Don't let them go that long, because after a while that urine and ammonia can cause changes on the skin and actually change the pH and really cause some significant damage. You want to make sure that a baby's dirty diaper isn't kept on for too long. It's pretty much common sense. When you're washing them for a bath, there's some specific recommendations. We have a whole list on the page you can look at. So again, and then we have some products that would facilitate your ability to optimally take care of your baby and expose them to the least amount of unhealthy toxic ingredients, which tend to be pretty pervasive, shockingly, in baby products. So we thought it was an important issue, which is why we had an initiative to produce these, to make sure that you had some options that were providing your baby with the best possible solutions to keep them away from these types of toxic influences, because there's the little things that make a difference frequently, and it doesn't take that much extra effort to integrate these into the whole program, which is really a whole process that you and your family can use to take control of your health.